Welcome everyone to yet another important discussion. Today's topic is on waste management and its impact on public health. My name is Miriam Dangasuk. I'm the moderator. I am a chemical and process engineer and have specialized in energy and environmental engineering, as well as policy analysis. I have over 7 years of related work experience in both the private and nonprofit sectors. I am currently working for the Africa Center for Strategic Process in Washington, D.C., where I explore policies promoting the responsible use of energy, natural resources, and the environment. I also conduct extensive research on water and food, power and clean energy, and also on the implications of climate change in Africa. Previously, I worked for the International Committee of the Red Cross as a water and habitat engineer in South Sudan, and also for Schlumberger as a field engineer in Norway. In addition to my experience, I hold a master's in global environmental policy from the American University in US, and a master's in environmental and energy engineering from the University of Sheffield in the UK. I also have a bachelor's in chemical and process engineering from Moi University in Kenya. I'm also an alumnus of the Mandela Washington Fellowship from the University of California, US. And now I will introduce the panelists. I have engineer Abalo Irene Jerry. She holds a bachelor's in chemical engineering from the University Technology Petronas in Malaysia, and a master's in energy and environmental engineering from the University of Flensburg in Germany. She has previously worked as a process engineer for SIPET and a consulting process engineer for GPOC. She also worked as a researcher at Flensburg University in Germany and as a technical coordinator for Beneficial EV in Germany. She is currently working as a director for Eastern Energy, which is a South Sudanese renewable energy company, as well as pursuing a second master's in wind engineering at the Flensburg University of Applied Science. Dr. Joy Luba is a medical doctor and a public health specialist currently working with the World Health Organization, focusing on health systems, strengthening and supporting the COVID-19 outbreak response in South Sudan. She has a master's degree in public health from the London School of Hygiene and Tropical Medicine, and have close to 12 years of work experience in public health and clinical practice. Prior to working with WHO, she worked with UNICEF, Medea International, Al-Sabas Children's Hospital, and Kijabe Hospital in Kenya, therefore gaining experience in working with government institutions, NGOs, and the UN agencies. She has also worked and engaged multiple stakeholders at the country, regional, and global levels, particularly on the public health front, establishing critical networks and collaborating with stakeholders to ensure effective delivery of health services. I also have Ms. Rose Michael, who works with UNICEF South Sudan as water, sanitation, and hygiene specialist. She has extensive experience of 19 years in the field of water, sanitation, and hygiene, with a focus on humanitarian interventions, recovery, and development phases. In addition, she has in-depth knowledge of integrated programming with other sectors for delivery of best results for children, including the upstream engagement, building of partnerships with government and other actors. She has been instrumental in developing of WASH legal frameworks in South Sudan since the signing of the CPA. She has actively led the South Sudan sanitation subsector, including the inception and implementation of community-led total sanitation, as well as gender mainstreaming, gender-based violence risk mitigation, and menstrual hygiene management, mostly in schools in South Sudan. She has also supported the government with the development of the WASH sector budget brief. She holds a master's in environmental science from Kenyatta University in Kenya, and also a bachelor's degree with honors from Akfad University in Khartoum, Sudan. I also have Ms. Nyathon Mai, who is a program officer in the Department of Environmental and Natural Resource Management at the Sud Institute. She has a bachelor's in geology from Federation University Australia, also known as the University of Ballarat. She has an MC in Global Energy and Climate Policy from the School of Oriental and African Studies at the University of London in the UK. Nyathon is also the co-founder and managing director of My Referendum for Freedom. that actively engaged South Sudanese youth from all over South Sudan and diaspora as a vehicle for civic education to the rest of the populace during the South Sudan referendum. She also devoted most of her time to the South Sudanese community development in Australia. And finally, I have Ms. Alice Sabuni, who is an environmental specialist, scientist, chemist, and mother with interest in environmental sustainability. Ms. Sabuni received her bachelor's in environmental science and chemistry from Wright State University in 2008 and a master's in environmental management from the University of Houston in 2018. During her most recent tenure experience in the chemical and petrochemical production, Ms. Sabuni has fed her insatiable interest in the environmental monitoring and compliance areas. Her daily job duties involve monitoring the impact of air, water, and waste pollution on the environment by identifying environmental issues and recommending solutions. In January 2021, she founded EcoClean, an environmental consulting and services in Juba, South Sudan. And EcoClean has already partnered with Waira Group based in UAE to bring world-renowned and environmental sustainability solutions to South Sudan. Welcome everybody to this discussion. I will now give a brief overview of our topic before asking our panelists some questions. Waste can be any material that must be disposed of and can be classified into three groups, which are liquid, gaseous, and solid waste. The solid waste consists of the material thrown away as trash or garbage from our homes and institutions. Waste that is not properly managed pose a serious health risk and lead to the spread of infectious diseases due to their unhygienic conditions. Unattended waste lying around attracts and create breeding places for insects such as flies and mosquitoes, provide food and harborages for rats and other rodents, which acts as potential disease transmitters which in turn spread diseases. Plastic waste, also not disposed in a proper way, is another cause for rise in public health problems. Therefore, excessive solid waste that is generated should be controlled by taking preventative measures. Furthermore, the concentration of population in cities, towns, and camps require appropriate resources, infrastructure, and services to treat solid and liquid waste. In fast-growing urban areas, waste management has become increasingly important as the strain on these facilities can directly impact the environment and subsequently human health. Juba in South Sudan, like any other developing country in the world, has a problem of collecting solid waste. That is 1/3 to 2/3 of the solid waste generated is not collected. Therefore, municipal solid waste management has become a complex developmental issue in Juba. Unfortunately, our collecting and dumping process mix everything together and makes separation an expensive and sometimes impossible task to properly manage all these wastes. Therefore, the management of waste should focus on how to find the value and redirect it back to the community. I will now move on to the questions. Engineer Abalo Irene, could you briefly tell us then what is waste management and what is recovery in waste management? What are the procedures and how can South Sudan handle its waste management? Thank you.
Thank you, for that brilliant question. So to start off with our topic, which is waste management, the term waste management is a collection of activities from when waste is produced up to when waste is disposed. These activities include of the wastes to their various disposal locations, processing of the wastes, recycling of the waste if possible, and then disposal of the waste. And even after that, it also includes monitoring of the disposed wastes. So that's waste management. And recovery in waste management. Recovery is a term used in waste management to basically mean putting value into our wastes. So what recovery means is when waste serve as a useful purpose for another process, it could be as a useful purpose in the economy, for technology, it can be an input or a resource for a certain technology. So that's what recovery means. The third question, I believe, was what are the procedures for waste management? So to summarize this, it can be summarized into three main procedures. The first one is identification of the waste. So you need to know what qualifies as waste. And this is up to each and every one of us in homes. We know what we need to discard or call waste, or what is useful to us. So the first part of waste management procedure is identifying what our wastes are. And then the second part is evaluating these wastes. So with the evaluation of the wastes, Engineer Miria earlier on kind of described the different categories of waste: solid, gaseous, liquid. So this comes also under our evaluation of the wastes. You need to know, is our waste solid? Is it recyclable? Is it organic? Is it hazardous? Is it medical waste? And then also treat them or handle them accordingly. So which leads to our third procedure of waste management, which is the managing of these wastes. So in Western world, or maybe in other countries of Africa, they emphasize on separating wastes. So you have different baskets or different bins for organic, for recyclable, for glass, for metals, and for collection of other wastes that have no use. So all of these come under part of managing the wastes in the procedure for waste management. And how can South Sudan, sorry, can you ask the fourth question once more time?
Yes. How can South Sudan handle its waste management?
All right. So how can we handle our waste management, which is a huge problem? If you live in Juba, you can be greeted by heaps and heaps of wastes along the streets, in our neighborhoods, even in homes, everywhere. So we can manage this by following, there's what is called the 5 R's in waste management. These 5 R's are reduce or reduction, reuse, recycle, recover, and residual management. So reduce is, for example, I've gone to the local market to buy some stuff. So for every product you buy a tomato, they put it in a plastic bag. You go to the next stall, you buy onion, they put it in another plastic bag. You go to another stall, you buy a vegetable, whatever it is, every product you buy, you get separate plastic bag for that. So this one, you're creating more and more wastes every time. So to reduce this, why don't we go with GUFA, baskets? So reduction is basically limiting on the amount of wastes we produce. It can be in homes. There are people who are hoarders. They like to collect a lot of things to a point where they don't know which one to throw or which one to keep. So you can start distinguishing what is useful for you in the house and what needs to be thrown away. And if you go to shops or supermarkets, try to go with things that you can reuse. So that's where the reuse comes in. You can use materials that will enable you not to accumulate waste, like, as I mentioned, the GUFA or the basket. You can use that to go shopping with, and you don't need an extra plastic to put in your tomato or your onion. You can just dump everything in your basket. And recycle, unfortunately, there is not one single recycling unit in the country. So you find the plastics litter everywhere, especially the water bottles like this one there. After you've finished using it, it's thrown away. Some things you can reuse them or you can recycle them. But for this to happen, we need a recycling plant, which we don't have. Hopefully, we can have that in the nearest future. And recover, as I mentioned earlier, is when you put value in the waste. Now, this is where you will need your engineers or your technology enthusiasts to come into play here, to be a little bit innovative and find purpose for the waste that we produce every single day, to try and make use of them instead of just dumping them along our roads or in our neighborhood. Yeah, and the third one is residual management. So with this, there's some wastes that are very sensitive. For example, medical wastes, you can't just dump them everywhere. So they should be treated in a very special way where the local residents should not have access to them or should not even see them. So these are the sort of things that we as South Sudanese can adopt, especially the ones that we can do right at home, starting from our families. Try to reduce on just collecting caveras or the plastic bags. Minimize on if you buy water, drinking water, just buy the one in a jerrycan where you can, the 20-liter jerrycan. After you finish it, you can take it back and refill it, and just minimize on accumulating on extra plastic bottles or whatever it is that are a problem to us at the moment. Thanks.
Thank you. And now that you have described what waste management and recovery is, Dr. Joy Luba, could you please tell us what is public health and what is healthcare waste management? Are there any types of medical waste? And what is the importance of waste management to the human health and the environment?
Thank you so much, Miriam. I think it's a great opportunity to discuss this really important topic. Yes, public health, as we know, I think we will begin by just reflecting on what health is, because then from that point we expect.
Dr. Joy? Okay, let's give her a few minutes. All right. I think as we wait for Dr. Joy, we can move on. I would like to go to Ms. Rose Tawil. In Juba and other parts of South Sudan, there's no doubt of seeing garbage everywhere, especially on the roadside and in the middle of.
I think Joy is back. Yeah.
Joy, are you able to hear us?
Yes, Miriam, I think we're having a little bit of internet issues where we are, but I think I'll proceed. I began by describing what health is. Public health in general, it actually looks at, it's both a science and an art. And it's a science and an art focused on prevention of disease, promoting life, promoting health and well-being, and prolonging life. And therefore, it really involves organized efforts. It's very conscious, and it's organized efforts over society and informed choices that are made by individuals and by communities. So in general, it looks at analyzing the various determinants of health that affect a population. You look at the risk that the population may be exposed to, and then you come up with activities that will help to prevent the populations from getting disease, that will help to maintain their health and to prolong their lives. So that in general is public health. It's public because we're looking at populations. The public may be as small as a small community. It could be a small village, but it could also be an entire country. It could be the entire globe. So we are really focusing on population health when we talk about public health. When we look at healthcare waste, this is waste that's mainly generated as a byproduct of the process of providing healthcare. And healthcare can be provided in hospitals, in health facilities. Healthcare can be provided within the home. So you can actually generate some degree of healthcare waste if you're providing healthcare within a home setting. And we also have other facilities that are related to health, such as medical laboratories, research facilities. So any kind of waste that is produced as a byproduct of the process of healthcare is considered as healthcare waste. Different countries usually categorize healthcare waste in different ways. It really depends on the type of waste or the materials from which those wastes are produced. And so we have various classifications. I'll just use one example where we have 4 broad classifications. But if you look at different countries, you realize that most other classifications actually stem from these general broad classifications. So one, we have general waste, and that's waste that's not really necessarily infectious. It may be due to processes that take place in a hospital or in a healthcare facility, processes such as administrative process. So it's just general waste that's produced, and that can be produced not only in a healthcare setting, but in any other setting. And then we have infectious wastes. These are wastes that can lead to other people becoming infected. And so they're broadly categorized as infectious waste. We have other sub-categorization that mainly stem from this. We have what is referred to as pathological waste, and this is waste where you have, for instance, human tissue that's involved or body parts. They are infectious as well. They could be infectious, but they are a separate category of waste that could potentially be considered as infectious waste. We have another broad category, that's hazardous waste. Those are wastes that basically they are a form of a hazard. For instance, we have needles, surgical equipment, wastes that are actually a hazard in themselves. Apart from the fact that they could potentially be infectious, they are actually a hazard in terms of the content of that waste. And then another last broad classification is the radioactive wastes. And these are wastes that are produced, for instance, when you have treatments, radioactive treatments, or you have equipment that actually, for instance, X-ray machines. So such kind of waste are considered as radioactive waste. As I mentioned, there are much more classifications than these broad classifications. Different countries consider different ways of categorizing their waste, but most waste generally fall within these categories. So why is healthcare waste really important? I think one thing that's critical is that they have a potential risk and an obvious risk of transmitting disease. One is to healthcare workers themselves. Healthcare workers are part of the community. They're an important form of human resource, and therefore it's really critical that healthcare waste is properly managed. And when we talk about management, we're talking about looking into procedures of how you can reduce the production of healthcare waste, how you can minimize healthcare waste in general, and then how you can properly dispose healthcare waste without posing a risk both to healthcare workers and to the community. So in summary, healthcare waste is really a very important component of waste, and therefore of waste management. It can pose a great risk of infection to healthcare workers who, for instance, in South Sudan, are a critical resource. There are very few in the country, and they can cause broadly a risk to the population if they are not properly disposed. And therefore, there's need to pay attention to healthcare waste management. Thank you.
Thank you, Dr. Joy, for giving us the different classifications of healthcare waste and how to manage it. We also know that the provision of safe water, sanitation, and waste management, and also hygienic conditions is essential for preventing and protecting human health during infectious disease outbreaks. Ms. Rose Tawel, could you tell us, in Juba, South Sudan, we see there is garbage everywhere. What is your take on that? How is this a concern of WASH? You have to unmute your microphone.
Yeah, thank you, ladies. And I really want to appreciate each one of you for the contribution towards this important topic. And as many of you have agreed and said that it's really a topic that is overdue to be discussed and overdue to be really tackled. My take on what is the solid waste or what is happening in Juba, if I have to give you a quick take on that, of course, Juba is very filthy. Juba and other parts of South Sudan, like the cities, are very, very, very filthy. But Engineer Balo have just mentioned a lot on what is, Engineer Miriam have mentioned a lot in terms of the growth of the cities and towns. South Sudan has been classified or has been defined as the most growing town or cities in the world or country in the world. That, of course, it comes with advantage and disadvantage. Disadvantage is simply because when we look at South Sudan has grown very fast, and particularly the urban cities like Juba. And this rapid growth in the population has put significant pressure on the already inadequate waste management services. Simply because either the institutions are not ready to manage this waste management, or they have not been actually identified as these are crucial issues that will affect the human lives and affect our environment. So if we look at what is happening in Juba today, nobody's happy. You will look at the streets of Juba, it's piled with heaps of garbage and all, name them, all the waste classifications that Dr. Joy is talking about. It's existing in Juba. Today, if we look at waste in a sense of solid waste and the liquid waste, which we have not even talked about the liquid waste, Juba has no sewage system. So all these are issues that is really, and unfortunately, we are not talking about it. And we keep on getting a lot of issues that are really affecting this country. And silently, people are just seeing it and keeping quiet because no one wants to talk about it. But like I said, I'm glad that this forum is really addressing some of these issues or bringing these kind of issues in the attention of others, and particularly those who are supposed to be taking care of this, so that these issues are brought into the table for discussion. How is it concerned to the wash? I've mentioned it. It's not only concerned to wash, as per se, the wash sector, but solid waste and liquid waste is concerned to everyone, and it's a concern to all the sectors. Every sector in South Sudan, waste management, it should be a concern to them, because it is affecting negatively our environment, it is affecting negatively the human health, and so when it becomes an issue, it is not just one sector as WASH that is a concern to it. Dr. Joy has mentioned a lot. If you look at the waste that is collected from the hospital, where are these wastes being collected? Where are these wastes being dumped? Is there anybody really taking time to know where are these wastes collected and dumped? Because these are the concern. The wastes are collected, but no one then follows as to where these wastes are dumped. If we know where they are dumped, are they handling? The handling of this waste, is it done well? Is it done properly? This should be a concern of the entire sectors within, the social services within South Sudan, which we are still struggling and we are still facing. I think I'll go more into the details in the next question, because this particular question is just what is the take and how is it a concern to the WASH particularly. But I'll give more detail as we move forward. Thank you.
Thank you, Ms. Rose Tawel. So she has painted a really clear picture of the waste problem in South Sudan. And I know by now all of us have heard about the oil field challenges, the oil field wastes being dumped in the northern parts of the country. Ms. Nyathon, does South Sudan have a specific policy on oil field waste management? If yes, what are some of the most important elements in that policy or policies? And how are the policies being implemented? Could you kindly recommend a strategy that South Sudan can adopt in tackling the issue of oil field waste management? Thank you.
Thank you, Engineering Mariam, for these are great questions, and to all the ladies who are having this great discussion. I think Engineering Ebola sort of really highlighted exactly and defined what are different categories of waste, and basically focusing more on the municipal type of waste in Juba, and as well Dr. Joyce talked about the medical section waste. When we talk of oil field waste, when we produce oil, there are some of the byproducts that comes together with the production of oil, either in terms of drilling or exploration, that we don't need, that somehow that are needed to be properly disposed, because they come with a lot of heavy metals and that are detrimental to the environment and the community. So these sort of waste, these oil field waste, need to be properly managed. I mean, the government need to have a plan of action in terms of policy of how to collect them and dispose them properly, so that they don't become detrimental to the people living around the oil field and to the environment around it. And also, there have to be laws that regulate this company that produce this byproduct waste. When we come to South Sudan looking at the policy, there's really no specific policy that focus on the oil field waste. It is only mentioned in the South Sudan National Environmental Law, policy for the 2015 to 2025. There's no specific section that really dwell in details on how to manage the oil field waste at the oil field, let's say in the Unity State and Upper Nile. It is mentioned generally in the policy, but there's no focus. And we know that oil field waste is one of the biggest issues that we have at the moment. We've heard in the news, we've read report studies and see how that is actually impacting the community in terms of public health and diseases and the infection that our community are going through. So that's one. The only legal document that clearly mentioned specifically on how to handle the issue of oil field waste management is the Petroleum Act of 2012. And specifically, I'm going to look at my notes a little bit, there are provisions that are given to environmental management. It's not entirely on the waste management, but it is mentioned at subsection in there. And for an area that is particularly focusing on the waste management is that the companies that are involved either in the exploration of oil or the exploitation of oil are required to prepare environmental management plan before they start oil activity within in the area. And within this plan, they are required to establish and create ways in which to collect and dispose these oil field waste, so that they don't become a problem to the environment and the community. To me, this is the only legal law that does mention to where how the waste will be implemented. When it comes to is it being implemented, we all know in South Sudan we have beautiful laws, we have policies, but when it comes to implementation, there's a lot of, we all know that. So we did a study, and specifically looking at the Petroleum Act, sort of seeing is this being implemented or not. And our finding from the research, looking at how the companies were handling this, let's say, type of waste is produced water, which comes as a byproduct. When you bring out oil, it comes with produced water, and this produced water have to be disposed somewhere. So they have this open pit where they don't follow the regulations of what the law said they should follow. In completely none of them, you find you have chemicals being chemical vermil, if I can say, they're being disposed on the roadsides. You have produced water being disposed in open pit holes where animals could access area, and even the community and even kids will play around. So we realize that actually this is not being implemented. And part of the reasons why there's no implementation, as we know, first of all, there's no political will within our government to really tackle the issue of waste management. We're only focusing on the oil and the resources that it brings to us, but we don't care about what comes with it and who get affected. The other one as well, as I will talk about it when I come, is how the institution have been set to tackle the issue of this oil field waste. And I'm talking about the Ministry of Petroleum, I'm talking about the Ministry of Environment. There's supposed to be Gas and Oil Commission, and there's supposed to be Environmental Management Authority. There's sort of a mix. So some of these institutions have not been formed, and I'm talking about the Environmental Protection Authority has not been established, which is very important in terms of how to implement policy on the oil on the oil field waste management. Second, as well, we have the Oil and Gas Commission that is there but is not functional, and it has a role as well in how to monitor the regulations. And as well, when you look at most of the work that is being done by the Minister of Petroleum, and even part of what the Minister of Environment that needs to do is actually being implemented with Minister of Petroleum. So basically, Minister of Petroleum is checking itself instead of being checked by the Minister of Environment. A lot of the environmental work that needs to be done to make sure that the oil company abide by these rules is being done by the Minister of Environment itself, which doesn't work. You can't check yourself. Somebody have to sort of monitor if you are following the laws or not. So this is part of the reasons why this is not working. I will stop here, and then there are more reasons. I'll proceed in my next question. Thank you.
Thank you, Ms. Nyathon Hotmai, for indicating that there's a need for implementation of policies and laws for managing waste. So that being said, Ms. Alice Sabuni, what are some of the international standards for waste management in the world? And is South Sudan implementing some of these standards? Thank you.
Thank you, Miriam. Thank you, ladies, for being here. That's such a great question. So, like, we're trying to tackle the issue of waste. I was in Juba in 2019, and like a lot of us, when you get to Juba, you feel like you're welcomed by heaps of waste. That's the first thing that welcomes you to the country. So I'm glad we're here. I'm glad we're talking about this. So to talk about waste, like a lot of you guys did mention, what is a waste? And some of the international laws that are available, the IFC and the World Bank actually gives a lot of rules and regulation regarding waste. From when we talk about waste regulation, at least in the US, we talk about cradle to grave, from the point of generation to the disposal. And along all that path, there's a lot of rules and regulation that governs how you handle the waste, from that point when you create it to all the way down to the disposal of it. So a lot of those rules and regulations are there actually that governs that. So some of it is actually around waste management, around hazardous waste, around recycling, and around non-hazardous waste. In the US, we have the EPA, which is the Environmental Protection Agency, actually have some of this regulation that makes it absolutely clear for us to do that, to make sure. So a lot of the service company, a lot of in the household, and a lot of the industry actually do that. So I am not familiar with a lot of the rules and regulation in South Sudan, but like Ms. Nyatham said, that we don't have some of those rules actually implemented in place. So how do we do that? How do we make sure that those rules are implemented? And I think the buck lies to our Department of Environmental to actually get some of this regulation implemented in place and making sure that not only are we able to do that, but we actually have the governance, the compliance aspect of it. So it's all good when you have rules, but how do you comply? How do you make sure that it's actually been implemented and it's actually being the checks and balances? How is that being done? So with that, at least in the US, the EPA actually create some of these rules, and it's on the national level. And then the state usually will take a lot of these rules. In Texas, where I'm at currently, is the Texas Commission on Environmental Quality will actually take some of these mandatory rules and create sub-rules so they're able to manage the issue of waste. And like in a lot of places, a lot of waste is handled by municipalities, and municipalities will take a lot of these rules and make sure that they comply with it. But the enforcement is usually done with the states. So for me, working in industrial sites, we have a lot of audits. And some of our audits rely about, like we said, from generation, from the time we generate waste, we have something called satellite accumulation area. And that's where you actually put the waste in. And those regulations, there's very specific regulation that tells you how often you inspect those areas, what record keeping requirement is needed. And when I have an audit, I'm required to show some of those proofs that showing that we're doing what we're supposed to be doing based on the regs that was given to us. And we move on to something called a 90-day waste area pad. And that's in an industrial site where we're actually not holding waste in any of our premises more than 90 days. And once it gets there too, there's a lot of rules and regulation that tells you from how you label drums and where you put waste, to containers, to bins, whatever the collection method is, there are rules that governs around that. And as we get the waste on outside to disposal center, to landfill, to incineration, to whatever method we're using, there's a lot of rules, including DOT, Department of Transportation, that governs how you label the waste, how you segregate it, how you do that. So when anybody who is on the street is easily able to read and see what kind of a waste is going on the street and what needs to be done with it. So all those requirements are there, and all those requirements are given to you whenever you decide to build any plant, any businesses or anything like that within the Minister of Environmental or the EPA or the TCQ. Those rules are given. So you have to get a permit. So once you get a permit, those rules are clearly given to you on how you govern some of those waste. So some of those environmental rules are applicable. Some of the environmental rules are there very clearly. It's just a point of how do we mandate it and how do we implement it in South Sudan. And like I clearly say, I wasn't able to find a lot of any policies or any environmental rules regarding waste management in South Sudan. Thank you.
Thank you, Ms. Ali Sabuni, for talking about the governance aspect of waste management. And that being said, Engineer Balo Irene, then what is the advantage of waste management, and how can we solve the waste management problem from an engineering perspective?
All right, thank you. Thank you, ladies. Thank you, Engineer Miriam, for that question. So there are so many advantages to waste management. So the first one is having to have our environment clean and fresh and also pleasant to look at. And the second one, waste management reduces environmental pollution. As Ms. Nyathon earlier on stated what goes on in the oil fields, there's a lot of pollution when it comes to waste disposal around that area. So that means it's not only land pollution as well as air pollution, because from an engineering point of view or having worked with the oil field, you know that there's petroleum gases being released to the atmosphere from just disposing it to the environment. So when this is properly managed, then you have pollution being reduced. It also controls unnecessary spread of diseases. This is mainly from hazardous wastes or even from just dumping waste around. Diseases can be controlled. And if you look at recycling, which is a form of waste management, it helps people earn money. So in other countries, people gain money from, recycling waste. I've seen little boys around Juba. They walk around with big plastic bags collecting these water bottles. So I'm sure they get money out of it after, taking it. I don't know where they take it. I need to trace where they take them to. Yeah, but it helps people earn money. And also waste management, enhances employment opportunities. So if you have people who work in waste management farms or plants, it provides employment. Now, from an engineering point of view, how do we manage our waste situation in South Sudan? So the first thing first, we need to look at our innovative selves as engineers. We need to look at our innovative minds. What can we as engineers of this country do? We can do a lot, but sometimes I feel like we don't really trust in our potential like that. And maybe there are other factors like the policy that hinder our efforts, or when you want to do something, then, I don't want to go into the barriers because I believe we can. Yeah, but we need to be innovative and creative. The other countries find value into the waste. That's where I mean, earlier on, I talked about the recovery of waste. We can do that. And we can do this also by adopting technologies that are working, they are working in other places. We need to adopt them here. There are so many technologies that I think there's another part of this discussion that I will mention. What are these various technologies and which ones of these can be applied here? But yeah, we need to be innovative and creative, and also adaptation of technology, and we need to kickstart our entrepreneurial spirit. That's the only solution as an engineer that we can provide for this waste situation waste situation that we have in our country. Yeah, but of course, there are others that I mentioned earlier that looks into individuals, it looks into, the social aspect. Now that each one of us can do, but as engineers, we need to wake up, be innovative and creative, look at the wastes, not as wastes, but as, when I look at the waste around Juba, I see resources that can be used for a lot of things. So let's all have that sort of mindset and that spirit, and then we can do something collective. Yeah, did I answer?
Yeah, thank you, Engineer Balo. I definitely agree with you about the need for innovation in South Sudan and use of technologies. The proper management of solid waste generated from housing and institutions such as hospitals, health centers, public eating and drinking establishments like hotels and restaurants, as well as businesses and working places, is very important part of environmental health service in our community. Dr. Joy Luba, so how does waste management, including this garbage and its management, lead to public health concerns, more specifically?
Thank you, Miriam. I think, as we've highlighted before, that health is really not just the absence of disease. Health is much broader than that. So garbage and waste in general does have an impact on health at different levels. So one, if you look at, we've talked about healthcare wastes, and we've underscored the importance of cutting transmission within healthcare settings in particular. Of course, a hospital is where sick people come. So that's a focal point where it's, people are likely to get diseases, the healthcare workers themselves. So that in itself has an impact on public health in terms of affecting those who are directly involved in providing healthcare and limiting their ability, their availability in case that they do get infected in a healthcare setting. In such kind of settings as well, we note that you would also want to avoid cross-transmission in healthcare settings, and that then is in instance important to ensure that you have proper waste management processes in place. And of course, we have people coming to healthcare settings who are not sick. So caregivers, visitors, they carry infections from that kind of setting to the community. And therefore, it would be important to ensure that in a setting where healthcare is provided, there is the right processes are in place to manage waste. Now, looking at the community broadly and looking at waste management in general and garbage in general and its impact on public health. One, as noted by the other speakers, some of this garbage actually predisposes the community and the populations to infection. For instance, if you look at the lack of proper solid waste disposal in the country, there is a very high risk of water bodies being polluted, and the fact that we do not really have a very well-established water supply system and also sanitation system in the country, then there's a high risk of transmission of fecal-oral diseases that are transmitted fecal-orally. And so that in itself is of great public health concern, because it can actually result in outbreaks, it can result in epidemics, and then it becomes an entire public health issue. And that's why we do have, for instance, vaccines to address some of these diseases that are actually transmitted, for instance, fecal-orally and in different other modes of transmission. So one is the fact that it can actually lead to a major outbreak of disease within a community. Secondly, we look at the fact that garbage sometimes actually provides breeding ground for rodents, breeding ground for instance, mosquitoes, improperly disposed garbage. And that is also a public health risk. Why? Because we have, for instance, malaria. Malaria is endemic in South Sudan and many other countries in Africa. And you really note that within these countries and many third world countries, it's really a matter of environment. It's really a matter of how the environment is, how garbage is disposed. And therefore, this is of great public health concern. We've not been able to control a disease as simple as malaria. But that, I think, goes back to the environment and how we dispose waste, we dispose garbage, we take care of the environment in general. So broadly, garbage and waste management does impact on public health on that aspect of disease transmission within communities. Another component of its impact on public health is the fact that health is also a state of social and mental well-being. And I think, that kind of living in an environment that it's unsightly, that because of garbage, sometimes it's foul-smelling, does impact on people psychologically. It may not be obvious, especially when you're used to living in that kind of environment constantly. But when you do move to an environment where garbage is actually well managed, you do notice a difference, So I believe it does also have an impact on people's psychological well-being. And therefore, that is as well a part of public health in terms of addressing mental health. And lastly, waste and garbage in general can also actually pose a physical hazard to communities and to people. I think I would also want to mention that they can have long-term effects, especially where we have radioactive waste that's not being properly disposed, that's being released into the environment, that it can actually affect not just people now, but it can affect subsequent generations, because sometimes radioactive waste or other kind of pollutants takes time to be eradicated from the environment. And so it does affect other generations to come. So waste in general, garbage in general, has a very broad impact on public health, and therefore it drives us to ensure that we put the right policies in place. Otherwise, we're going to spend a lot of resources controlling outbreaks and epidemics and vaccinating populations because of poor management of wastes. Thank you.
Thank you, Dr. Joy. for highlighting how waste can lead to outbreaks and hazards. Moving on, Ms. Rose Towell, you mentioned earlier on how there's so many questions regarding where waste is dumped in Juba and how the site is being used. Who are responsible? Could you maybe explain more to us, like who is in charge? And are the hotels and large businesses in Juba following these regulations for waste management? Thank you.
Thank you so much. The quickest answer is yes, we have dumping site, as I've said. And currently, the dumping site is in Gumbo site, for those who don't know, just after Shirikad, about 15 or more kilometers away from Juba town. Previously, there was another dumping site along Juba Yei Road, just behind Jebel Kujur, but that site has been closed. Knowing our issues in South Sudan with the land grabbing and all issues that is related to the land. So that site in Jebel Kujur could not be sustained and it has been closed. But right now, the dumping site that is active and people are using it is this one in Gumbo. Who is overseeing it or seeing the waste management? Right now, it's the Juba City Council. Responsible for collecting this garbage. I don't know, many of you who are in Juba have seen the trucks sometimes moving around collecting this garbage and throwing it in the Gumbo site. So Juba City Council is like the more or the core body that is responsible for overseeing this waste management. But then it should have not been really the Juba City Council alone, because if you look at the whole environmental policy, there should have been the regulators, and also then from the regulator, we go down to the implementers. Juba City is implementing, but who is regulating? That's another issue that until today it's questionable to everyone. Who is regulating these sites? Who is overseeing these sites, whether the dumping has taken place in a rightful way or the right way or not? So the garbage is just dumped and left there. Later on, I'll talk on really the challenge with that dumping site. But briefly, I can mention that the dumping site, as it is right now, if you go, particularly in the rainy season, it is inaccessible completely. You cannot even access that site because of the way the garbage is just dumped. It is completely filthy. It is completely unacceptable. But this is the situation South Sudan is in. Hotels and larger businesses in Juba following the regulations. There are a lot of issues that are happening, or a lot of things that are happening in hotels. Dr. Joy have talked a lot on the contamination of water sources. And one of them, if you look at the hotels in Juba, are all situated along the riverside. So there are a lot of activities that are happening. Particularly, I've mentioned earlier on the solid waste. These wastes are being thrown or being discharged in the rivers. Yes, there are people going from time to time to supervise or to see what is happening in the hotel. But most activities that are happening in the riversides are happening at night, where there's nobody. So you will see that proper services or proper sewage systems are not put in place. And so this sewage system, or rather these wastes, are discharged to the rivers. We don't have proper water supply system in South Sudan. The current water supply system is just covering the Juba town areas, and mostly, if you look at the geographical coverage of the water supply system, is mostly the Juba town areas. Out of Juba town, or rather the city, it is all depending on these trucks carrying water from the treatment plant to the population outside Juba. it depends on how this water is also treated. If this water is not treated, definitely people in Juba are drinking water that is not safe for the human consumption. And so today, if you go to every clinic, you will find that majority of the population going sick, they are diagnosed with typhoid. Then you begin to wonder, what is it? Why is it that everyone is having typhoid? It's a big concern. It's a big problem. So the hotels are managing business, but you also find that majority of these hotel business owners, our South Sudanese, are having shares in there. If the regulators gone there to finding that one hotel are having problems, these people are questioned. Somebody from above will come and really, threaten people and so forth. So this is really placing our country into a big, big problem. Our big problem, I mean, it's a big problem that is really need to be addressed. If the regulation is there, those people who are charged with the responsibility should not fear, even if the hotel belongs to Mr. Who, this has to be brought into the books. But it's not happening. It's not happening. For those who are living in Juba, you and I knows what is happening in the city. It's not acceptable. It's not right. It's not good. And it's really bad for the people of South Sudan. So I think that's all what I can tell you right now. But as we go along, we will expand more. Thank you.
Thank you, Rose. Also, most onshore oil field wastes, like in South Sudan, are disposed of at the site of the well from which they're generated. Ms. Nyathon, why is waste management very important in the oil fields then, especially in South Sudan?
Thank you again, Engineer Mariam, for the question. As I mentioned in my previous point, is that waste management is important within the oil field because if they will not dispose well, they're detrimental to the health of the community living around, to the animals, and even to the environment. It does change the topography of the environment around, which has later implication on the climate of the area, and then as well, it has other change of problems. So it is important to prevent that the people around don't get sick. We don't change the environment around the oil field. The animal don't get sick. It's very important that these waste management are well handled and disposed properly. I've mentioned before, we have produced water. This produced water, when they come out of the underground, when they are produced together with the oil, they have to be separated, and the oil can be produced into different products. But this produced water doesn't have use, and it comes with a lot of high toxic heavy metal that if they make their way to the soil, to the water, or to the air, basically pose public health to the environment around it. We also have, as I mentioned before, we have drilling mud. This drilling mud as well is a combination of different toxic chemicals that are used to sort of lubricate the grill bricks that they use to produce oil. If this drilling mud is not well disposed, it's very toxic to the environment, it's toxic to the people, it's toxic to the animal around it. So for us to prevent this, we've realized that, as we mentioned, there is completely failure on how these toxic wastes are handled. And these basically have managed to make its way to contaminate the water sources around the oil field areas, which people depend on. These toxic wastes have made its way to the soils that animal graze on, community farmed on, and as well the trees and the environment around it depend on that soil. We realize, well, these toxic as well have made it right even to the body of the community around it, which now comes with, we've seen the reports of community members, the people around the oil field, where we've seen of deformed children being born. we've heard cases of infertility around area where women are not getting pregnant, and as well a lot of miscarriages. So when these toxics basically move from where it's supposed to be and then getting into the environment around it, it has health implications, just in short. Thank you.
Thank you, Ms. Nathan. The importance of a waste management system must always be the delivery of a discharging service, which helps to maintain the safety and health of citizens and the environment. Ms. Alice Sabuni, you talked about the EPA and how waste is managed by municipalities in the US. What are some of the best practices we can adopt in South Sudan?
Thank you, Engineer Miriam, for that. And thank you, ladies, for all your inputs. So like I said earlier in my previous point is in the US, the EPA actually regulates household, industrial, and manufacturer and solid waste. And they clearly spelled it out in their in the record, what we call the Resource Conservation and Recovery Act, clearly spelled it out how we handle these waste. So that gives us a clear framework from the national level or from the federal government, clearly how we handle these waste from the point of generation, what we call from cradle to the grave. And what a lot of their local municipality, now it comes from there to states. So we do have the federal and we have the states. And in the state agency, so the federal covers everything. So from more dense populated areas like California to less dense populated area like Alaska. So that gives us the framework. And what states do is they take those regulations, which is clearly spelled out, and they create several similar laws. And most of the state laws are more stringent. The federal government just tells you that this is the law. You as a state, you create your own regulation that mimics what the federal has given you. And for areas that are more dense populated, they make those states' laws to be more heavier than the federal laws. And then we come down to municipalities. Municipalities will take their regular state laws and come up with what those waste management, because most of them are actually managed by municipalities. And there are a lot of checks and balances in the middle here. So given that framework, it makes it absolutely clear that when we have the support of the government, when we have the support of the federal laws, it makes it absolutely clear. Here, the issue of illegal dumping, it does not become illegal unless you have some kind of a rule, right? Before we talked a lot about hotels and stuff like that. Here, the laws and the fines are so hefty that a lot of the industrial waste, a lot of the industries are very, very, very heavy on safety and environmental. And I work in industry. It's always been safety first, environmental. But now environmental, then safety, because the rules and the fines that comes with it is very heavy that could easily cripple any businesses. So with that being given, for a lot of the, we talked about hotels and all that, we have something called permit. Before you build anything, you have to get a permit, not only from the state, but from the federal. And sometimes I sit at work and I have two different permits. I have a federal permit, I have a state permit, and sitting down to explain to managers what this is saying and what this is saying. And most of the time, you do not equate. One is more stringent than the other. And we always say we go by what is the most stringent rules and regulation. So if we're able to completely revolve, completely work on our policies in South Sudan and have that structure very clearly, federal, and make sure we do have very clearly, so we're giving a lot of our states and agency what rules to do, but actually expand the ministry beyond just the national ministry, give energy, give more power, give more work for this local government. What is the local government doing? Do we have environmental sub-team, substructure at the local level? So you get that and you get all the help. So the national government or the National Minister of Environment is not taking the full responsibility and the full mandate, but they're able to delegate it down to the state level. So once we have that system, makes it a whole lot easier for checks and balance, because we would have the state will come in and do audit, because the state wants to make sure that you're actually looking at your permit as retaining to environmental laws. And we would have the next day, the state will come in, and it always confuses managers. And it's like, what do you mean? We just had an audit. Why are they coming? Well, like, those are two different governing bodies, because you do have two permits when you get from the state from the government, from the national or the federal and the state. So having those structures and having those checks and balances, I think is going to help a lot of our issues in South Sudan, especially concerning enforcement. I heard Ms. Rose mention something about we do not have an enforcement governing body, which is the critical biggest thing in doing any law. If you don't have the police, right? We have police, we have military. What do? Their work is to enforce rules and regulation. That's the same thing that applies to environmental rules and regulation. If we're right, we can write and write and write them all we want. But if we're not enforcing them, we are not getting our point across. So having that enforcement governing body to enforce some of those regulations is very, very important. And making sure that they stand on their own, like Ms. Rose mentioned about doing an inspection and having somebody come. I heard the term when I was in Juba, Zolkebir. And then it's like, oh, Zolkebir, yeah, and then all what you're doing does not matter. That needs to be clearly, regardless of what you do, especially when it comes to environmental compliances. The CEO in my company, I'm probably the most hated person, or the most, like, has nothing to do with my personality, but because of how important environmental rules and regulations are considered in a lot of the industrial sites. That is very, very important that we do what we're supposed to do as stated in our permit from the federal and the state government. So sometimes you have to shut down production, sometimes you have to shut down hotels, or whatever you have to do if those rules and regulations are not being implemented properly. But being able to have those power, or whatever you want to call it, to do your job is very, very important, that we get the support not only from the federal government. We have to take it down to a government for them to understand how important that is, the compliant aspect of environmental regs and regulation. So if we can do that, I think a lot of our issues in South Sudan, especially around environmental regulation, will be very much implemented. And that's pretty much the checks and balances that, at least in the US, as far as environmental regs is concerned. Thank you.
Thank you, Alice. Engineer Balo Irene, earlier on you talked about source reduction and reuse. Are there any other categories of waste management strategies? And please explain to us some of the strategies that South Sudan should develop to tackle waste management.
All right, thank you, Engineer Miriam. So earlier on, I did mention a couple of scheme or strategies. So I'll just build on from there, I'll just add on the technological aspect of this. So landfill is one of them, but we already do have landfill in South Sudan. Unfortunately, it's not being monitored, as Ms. Rose Tawil earlier said. So the idea of the landfill, I think we got the wrong conception of what landfill is. So a landfill is supposed to be waste are dumped in there, but before they are dumped, they're supposed to be sorted. You know, the recyclable ones taken out, the glass or whatever taken out. And then the rest of the waste dumped in there, and then they build on. When it's full, it's covered with some soil, and it becomes a hill. And then flowers or some little plants are planted on there. So you will have, there are countries where you have man-made hills, but all made from wastes. So from the landfills. So we could also try and do this, you know, dig out landfills, proper landfills, not just a vacant area around our cities or in the outskirts of our cities and just dump waste there. And then nobody goes back in there to check what's going on with the waste. And then everybody just keeps on piling and piling and nothing happens. So we have we should have proper landfill systems. And there's also incineration. Incineration is basically the combustion of waste. So this is the burning of waste to produce steam, and then this steam can be used in steam turbine to produce electricity. So that's another way we can adopt, looking at waste to energy. So there are a couple of different technologies when it comes to waste to energy. Incineration is one of them. Another one that I can talk about as well is the plasma gasification, which is the thermal process by which wastes are converted into syngas. And then this syngas, you can use it to run a combined heat and power generator to produce electricity and heat. And then this heat, we don't need heating systems in our country. It's already hot enough. So this heat, you can as well use a steam turbine to produce electricity. And we all can agree we do need electricity in our country. And there's also fermentation. Fermentation is the biochemical process by which food or waste is broken down into energy fuel, such as methanol. So you have the waste being broken down by bacteria or other microorganisms, and then these convert waste into fatty acids, which are then further broken down into methanol. In countries like Brazil, you have cars running on methanol as fuel, or even butanol. And I've seen there are a couple of these gas cylinders. I think some of them are butanol, the gas for cooking. So those are ideas we can kind of adopt, that can work for our country. Then there's also the anaerobic digestion, which is the breaking down of, similar to fermentation. The difference is it happens in the absence of air. So you have an airtight vessel, can be anything. It can be made locally here. And then this anaerobic digestion, you feed it with anaerobic digester, you feed it with waste, microorganisms work on it in the absence of air, then you get biogas. And then with this biogas, you can use it for, electricity production using a CHP generator. A CHP generator is a combined heat and power generator for electrification. And the byproduct of this anaerobic digestion plant is the digestate. A digestate is, in simple terms, manure. So you can use it in fields, in farms or garden as fertilizer. And then there's another process that I had a chat with the Ministry of Environment. I wish the minister was here. The composting. So in their plan, they had, apparently, there are plans in place for recycling and the non-recyclable ones, which is organic waste. They were planning to put it up for composting. So composting is another process that you just use organic matter, naturally converted to humus-rich soil, called compost. Some countries or some agricultural farms use this compost in their agricultural, plants. So those are some of the technical, schemes that we can use or strategies that we can adopt in our own country. And these things are doable. They work. I've seen it work everywhere. Even our neighbors, Uganda, I think, is doing some anaerobic digestion things or incineration things happening. I've heard that there's an incineration plant being constructed in one of the oil fields, but this is mainly to burn, the used up chemicals that they don't need anymore. But what I do not know is, are they just burning it, or are they using it, waste to energy, like using incineration as a process? So if they could do that as well, that would be also an added plus. I've spoken a lot about, the recovery, reduction, reuse. I will not say more on them because I believe from the past two questions, been talking a lot about them, but I can only give a few examples of how you can reuse some of these things at home. I do have a friend, I hope she's watching, Miss Patricia. She reuses, old electrical cables with a few other materials. You can find them in the market to produce art. So, you can do things like that. If you have electrical cables, lying down somewhere around your home, there are a lot of videos as well on YouTube, how to use this to make art. So those are some of the things at home we can do to kind of try to help our country with this situation. Now, last point on this, there is another process that I forgot to talk about. It's called the pyrolysis. So pyrolysis is the heating of waste, biomass in the absence of air to produce biochar or biodiesel. So things like that we can also adopt. For example, you collect a heap of waste, plastic, whatever, fill it up in a vessel, then you heat it up, but make sure it's airtight. And then what you get out of that is what is called the biochar, which looks exactly like the charcoal we use from the wood. So by so doing, you're providing an alternative for energy source. You're also tackling waste management problem. And then if you look at the forest, currently there's so much strain on the forest for firewood and charcoal for provision of energy fuel. So you can uplift some of these, problems that are being faced by, we are all being faced by just these little things. So there are a group of young engineers and entrepreneurs. I actually forgot what their name was, but they used, the plastic. They heated plastic and then mixed it up with sand to produce what is called a biotile or something of the sort. So it's actual tile that you can use for construction, but it's made from plastic and sand. So these are things, as I mentioned earlier, as engineers in this country, we need to be innovative. Those are some of the ideas we can adopt, to tackle this waste situation in a technical point of view. Thanks.
Thank you, Irene. Dr. Joy Luba, is there any regulatory framework for medical waste management in South Sudan? Please explain. Thank you.
Thank you, Engineer Miriam. I think this is the core of our challenges, not just in the health sector, but in every other sector in this country. And I think it has been underscored by most other speakers that, and we know that governance at the end of the day is actually the driver of a lot of decisions, a lot of consequences and impacts. And so I think previous speakers have mentioned that there is a lack because medical waste management comes under the auspices of overall waste management in the country. And that comes under the Ministry of Environment. However, we do have within the health sector, we do have a national policy on medical waste management. And we even have as well a medical waste management plan that covers up to 4 years and guidelines for safe management of wastes. And for instance, the guidelines clearly outline the different types of waste. They outline the organization that is required in a health setting or a health facility. They outline the supplies that are required. They outline the logistics. They outline the different methods of how waste should be disposed. But as mentioned, this is in paper, and that needs to be translated into action. That for the health sector, that basically is the framework with which we, let me say, oversee and not necessarily regulate, but basically ensure that that medical waste is being properly managed and disposed. But as I mentioned, it should come under the overall regulatory framework, which should be under the Ministry of Environment. However, I would like to really highlight a couple of things in terms of regulation and enforcement of those guidelines that have been outlined for medical waste management. One is in the issue of, there are a number of things that are listed on those guidelines that are actually not available within health facilities. And so absence of resources is in itself a challenge. You can have a very good document that clearly outlines this is how you should manage waste, and this is how facilities should be organized to ensure that waste is actually well managed. But if you don't have the resources, if you don't have the human resources, first of all, to carry out the regulation, you do need to visit the health facilities. You do need to see if what has been stipulated in the guidelines is being followed. But if you do not have human resource, if you do not have people who are capacitated to do that, and even if you have not established the right kind of environment within those locations to actually follow those guidelines, then it becomes a challenge. So that is a key gap when we look at frameworks that have been put in place to actually regulate medical waste management. I think the other key challenge is the private sector. So medical waste is not just generated by public hospitals, but we do have the private sector, and especially in Juba, we have very many clinics mushrooming almost everywhere. And of course, those clinics do produce a lot of medical waste as well. And so it becomes a challenge in terms of oversight, because if you have so many facilities spread all over the town, and this is just in one town, so you can imagine in the states, in the lower levels of administration, what really happens in this location. So there is no, I wouldn't want to outrightly, just point out that the regulatory framework, looking at another ministry, for instance, Ministry of Environment, I wouldn't want to just point out and say maybe the framework is not in place or regulation is not effective, but I think focusing on the health sector, there is a challenge. There is a challenge in terms of regulation of medical waste management. And I think there is need to put up the right policies, to review those policies, to review what are the components that you need to actually effectively implement those policies, and also to see how you can work together with other sectors, because waste management is not just it does affect health in general, but it's not entirely a responsibility of the health sector alone. We need to work with other sectors. You need to work with Ministry of Finance. You need to be financed to be able to effectively implement some of those frameworks that you've put in place. But you also need to work even with Ministry of Housing and Physical Planning, because there's a lot that goes into the way facilities are designed and waste disposal systems are designed. And of course, working closely with the Ministry of Environment. So in summary, I think in terms of regulation, we are lacking that, a strong regulatory framework for medical waste management, and I think waste management in general in South Sudan. Thank you.
Thank you, Dr. Joy. Ms. Rose Towell, based on your experience as an expert, what are some of the diseases, including outbreaks, that you have seen happening with the lack of WASH in South Sudan? How are the development partners, implementing partners, donors, and government handling waste management from your own perspective? What needs to be done? What more needs to be done?
Thank you so much, Miriam. Diseases that are affecting this country and related to waste and washing particularly, I've already talked about typhoid being rampant in South Sudan, malaria, Dr. Joy have mentioned, because if you look at this waste, it's actually, it is playing like a breeding ground for this, for mosquitoes and all this. But I really want to mention cholera, hepatitis E. We had mentioned earlier the issues of E. coli in the water contaminations, skin infections, eye infections, worms, name them. There are many issues there are many diseases that are related to wash. But let's just look at cholera, for example. In the last 2 years, from 2016, 2018, South Sudan has been hit seriously with the cholera outbreak, and we lost a lot of people due to cholera outbreak. This tells us that there is an issue with wash facilities. There are no clean water, or rather water supply systems. There are no sanitation facilities. And the behavioral aspect in terms of hygiene issues also becomes a big problem. And that's why if you look at a country that a disease is almost becoming a pandemic, then there's an issue. So cholera has been completely, really sitting in South Sudan. But I think, thank God also for the last 2 years, in 2019, 2020, maybe due to other things that have come into South Sudan or globally, cholera has sort of like went quietly. That can tell us that maybe there is an intervention that has reduced the cholera, but in the past 2 years of 2016, 2018, cholera has been one of the major outbreak that has really disturbed South Sudan, and it has claimed lives of people, and too many resources that are supposed to be done for better things have been put to really address the issues of cholera. The development partners or the donors and government handling waste management, from my own perspective, I think in collaboration with the Juba City Council, Juba County Council, the PAYAM administrations, and the Ministry of Environment and partners, NGOs, donors, are all working together in addressing the issues of waste management. But like I said earlier, you don't expect somebody like, let me use the example of a donor. You don't expect a donor to come and clean your home or clean your house. Charity begins at home. We need to start by doing it for ourselves, and the other people will then come and help us. I want to go back to the issues of regulations or the legal frameworks that have been developed in South Sudan. If I looked at all the ministries in South Sudan, there are beautiful legal frameworks that are sitting in the shelves or sitting in all the tables of the technocrats or the even politicians. The documents are well developed and beautifully put, but the implementation, it's a big stake. Who is implementing it? Were these documents actually developed so that something is happening or not? So you see that people went to the donors to help the country develop these legal frameworks to give aid for support. But then whether we really know why we wanted these policies, it's a big issue. Whether we really know that why we needed these technical guidelines, or why we need the strategic frameworks, it's an issue. Because developing documents are something, it's something else, but then putting it in reality, it's another issue. South Sudan water and sanitation policy was developed right after the CPA was signed, 2005. And this document has really stayed beautifully like it was developed, put in the Ministry of Water Resources and Irrigation. Who is implementing it? The partners are there, but who is making sure that these partners are really implementing it? You know, many NGOs, many partners are on ground, but who is really giving an oversight to make sure that whatever is happening, it's in accordance with these policies that we have developed. Ministry of Environment, I believe, I went there several times. I had meetings with the undersecretaries. They have very beautiful policies. They have very beautiful legal frameworks, but are these policies developed only to sit in our offices? No. People of South Sudan really need these policies to be implemented. And these policies have to be translated into actions, which is very unfortunate today. Why people are suffering, why people are dying, it's because we have all these documents. I can tell you that I was deployed to go to Kenya. There are policies that we have in South Sudan that is not in countries like Kenya that has been stable and peaceful for some years. There are policies in South Sudan, there are regulatory frameworks that we have in South Sudan, but they don't have it. Instead, actually, our neighboring countries are looking at the policies that we developed. That the policies that we developed, the regulatory frameworks that we developed to copy what we have done. But unfortunately, we are not able to translate these policies into action. I mean, I'm talking with passion because it is very, very, it's very sad that at this time, right, how many years from the time the CPA was signed, formation of these ministries was put in place until today, down the line, how many years? And we are still tackling issues to do with waste management. These are supposed to be issues that are right in the beginning. Ministry of Environment was established in 2010. Until today, what are the milestones that happen in South Sudan? It's time for people really to be accountable for what has been given to them to look after. And it's not just, when this revitalized peace agreement was being signed, the president by then said that we don't need the vehicles that are being driven in South Sudan, but South Sudanese need services. Indeed, South Sudanese need services and not the vehicles around South Sudan. Where are these services? What are the people of South Sudan really have that liberty to ask those who are responsible that where are the services that we pledge to give the South Sudanese? Unfortunately. So back to what I'm saying, we lost many people because of cholera outbreak, which is very unfortunate. We are not supposed to lose people due to cholera outbreak. Cholera outbreaks or cholera are preventable diseases that can easily be prevented. Countries like South Sudan, if we put policies in place, we put things in place, people will not die of these simple diseases that are killing our people today. So when it comes to partners, donors, UN agencies, and other partners implementing this or supporting the government, because what other partners are doing, what the UN is doing, what the donors are doing, it's complementing what the government is supposed to do. So the government has to come in the forefront to really take their responsibility forward for other people to come and help. But you cannot sit and expecting the donors to come and implement or give you resources to and not implementing. NGOs are ready to do. Government, somebody mentioned the issues of capacity. You go to a ministry, there's only one person or two people. I understand with the current situation, the people are demoralized. Whoever is working in the government is very demoralized, but it is time for South Sudanese to wake up and say that, we pledge to help these people, we pledge really to have our country. And so it is our duty as South Sudanese to ensure that these services are to the people of South Sudan. So, yes, the ministries are doing their best. The government, the NGOs and the development partners are doing their best. The donors are doing their best. But I think the government really need to come in front to take their responsibility so that the other people are to help them. We've done preliminary environmental assessment of the existing dumping sites. Yes, the dumping sites have already been in use, but it is, like I said earlier, it's very filthy. When it gets raining, it is problematic. And so it becomes a challenge, like really, if I jumped on the challenge before my time comes to mention what are some of the challenges. These waste collectors, their lives are even in danger, because if you look at the way these people are handling this waste, it is a pity. There is no protective materials given to these collectors, and you see them really struggling to keep the so-called Juba clean, to keep other places clean in some other areas. UNICEF bought 3 compactors just some 3 years or 4 years ago. We bought 3 compactors. One compactor costed us more than $1 million, and we handed over to the Juba City Council. In the next day, 2 weeks later, one compactor is crushed completely beyond repair. Where are we responsible here? You know, these are resources that belong to South Sudanese, and carelessly we just, you know, leave it to go. So partners are trying, donors are trying, but I think so that I can end this point here, we need to see that the government really step forward and come forward that we need to do it ourselves. It's not enough just to have the policies. It's not enough to have, ministries that are responsible for sectors, but not doing something. These ministries are put there to implement, and let's see what is supposed to be done. Yeah, thank you so much.
Thank you too. Ms. Nyathon Hotmai, I have the privilege to have read some of your work, which is very impressive. Based on the research you've carried out on oil production in South Sudan, can you please give us an overview on some of the key issues that came out of the study, and what are your recommendations?
Thank you again for the question. At the Sudan Institute, as you mentioned, we've conducted several studies focusing primarily on the impact of oil production on the environment and the community living around this oil field. And as well, as I can tell you guys, I have Nial Tidmamer is the lead researcher when it comes to this subject, and I'm sure as well you guys read his work. One of the studies that we did, and I think that was 2018 or 19, we traveled to Poloj. And what we were looking at was that what was the pathway to which the contamination from the oil field waste travel to the to the community around there, and the soils and the water. And our key finding is that, because we've heard cases where community are claiming that they're getting sick, and the reason why they're getting sick is because of the pollution and contamination from the oil field waste, which depend who you talk to. The government do argue that until there's a scientific study that yes, these two are linked, they can't make that conclusion yet. It's the same excuse as well the oil company do give and say that the cause is not oil because there's no scientific link to it. So we went to sort of understand what are the really pathway that these chemicals that are resulting from the waste are getting to the community, and what does the literature say about if these toxic chemicals are within the human body. Our key finding was that, yes, the study that have measured the soil, and the conclusion that soil has been contaminated, it has higher dose of heavy metal than what is normal. The same thing with water, the same thing with underground water. So we realized that the community were relying on the soil that is contaminated where they were farming, and definitely the chemicals do make it to the product of the farm, and then people eat it. So that was one pathway. People were drinking water straight from the source that were contaminated, from the rivers, as well. Some people were drinking underground water, and the studies show that underground water is already contaminated. Some people as well were eating fish from the rivers. They were eating meat, and we realized that a lot of cows and goats were actually grazing around the oil field. So if the plants are contaminated, it's very easy to sort of transfer that path to the human being. The other key finding that we find was that some of the containers that the oil company used to keep some of the chemicals, were actually making their way to the community, and community were using it to store water for drinking. Some of the products that community were using. So we realized that these are not even supposed to be in the hand of the community, but they were. And somehow this is where contamination was, was being transferred to the community. So, so that was one study where we start to understand the pathway. The other key finding we found that is how community are frustrated. They feel that before the oil production happened, by that I'm talking specifically on the Polog area, this is where we did this study. They say that before the oil production, everything was normal. But since the start of the oil production, they've had diseases that they didn't even have before. We've talked about the infertility. We talked about deformed children, which these cases have actually increased than before. So to their argument is that oil field is what is costing us, and now the government is sort of arguing on the oil field otherwise. The other study that we did was now, as I mentioned before, we did evaluate the regulatory instruments that are used to regulate this oil company to manage this waste so that it doesn't transfer to the community. And our key findings was that completely, these regulations were not being implemented by the oil company. And as I've said, which is coming to my next question, there's a host of challenges why some of these beautiful regulations are not being implemented by the oil companies. And before I get into that, I'll leave that to the next section. Thank you.
Thank you very much. Ensuring evidence-based and consistently applied waste management practices in communities, homes, schools, marketplaces, and healthcare facilities will help to prevent the human-to-human transmission of pathogens, as we have already discussed. Ali Sabuni, what are the challenges and recommendations in relation to increasing public awareness on waste management?
Thank you, Engineer Mariam, for that question. So we talked a lot about the challenges we are facing and how when it comes to waste management, there's a lot of stakeholders in the picture. We have the government, we have the municipalities, we have the private sector, we have the public sector. So once we get all these people together, once we somehow get to a point where we actually get the stakeholders together, it's when I think for a lot of the environmental issues, especially for waste management, that we are able to actually solve this. But once all the stakeholders, everybody's in their own corner, that's why I believe issues are, especially when it comes to public awareness. So I think one of the major things that we South Sudanese can implement in our country is getting these stakeholders together. And that's involved, like I said, we definitely need the federal government. We need the national government to definitely be part of this, right? We need their take on it. We need their commitment. In a lot of different places, waste management could actually account for almost 20% of the national budget. I know I had a talk before where the Minister of Environmental specifically said how this ministry does not have any money given to it. 20% is a big number, right? Tell anybody, especially us Sudanese human being, what do you mean 20%? That's a lot of money, because we don't tend to see it, right? We don't see a lot of the environmental issues that arise until it becomes a problem. The issue with Juba waste management didn't get here overnight. It gradually grew to where it is. And it grew to where it is because we did not have the environmental regulation in place from the beginning. If we had some of those regs and we brought those stakeholders together to everybody to see it, just because it's out of sight, out of mind, which is a lot of the easiest thing to say, right? A lot of these environmental rules involves a lot of money. We're talking about regulation, we're talking about compliance body. In order to do compliances, you need a full department, not only with people who know what they're doing, but you have the regulation. How do you pay these people? How do you manage that? So that is a really, really big budget. And that's where our awareness becomes an issue, not with the population, but with our governing body, all the way from the top to the bottom. We need to get the issue of environmental regulation and all that really, really clear and make sure it's on the forefront of our government body and they're fully aware of it. Once they fully understand the concept, like Mignafan said, in oil and gas, we do have this beautiful regulation that is not being mandated. Then once we have the oil spills, we have all this, we're like, oh, well, we need to clean this up. And with a lot of the environmental thing, when it gets to that point, it costs a lot of money. It costs a whole lot. I wish we're talking a lot, especially in the oil and gas company, about how do we prevent the spills? Why are we not focusing on that? We're focusing on after the math when it's completely, the issue happens. So if we focus on that initial state, and that comes back to what? Our regulation, our compliances. In order to do that, once we have the compliances, and it's a completely different entity from the regulators, and they have the ultimate power to do those services, then we don't have the issue, checks and balances. If you're going to come and check me for anything that I do, I'm going to do what? I'm going to make sure that I'm ready. In my field, I always tell my guys, we have to be audit ready, because anytime the federal government, anytime the state government could be knocking at my door asking me, I want to do an audit on you. So I have to be audit ready all the time. So I got to make sure that our rules and environmental rules are followed. Some of the environmental rules are very tedious. Some of them, an amazing professor told me one time is, when it comes to environmental, leave logic at the door. So that becomes our issue with a lot of our regulatory body, that they don't understand it, right? If you ever picked up an environmental rule, you'll read it and you're like, what are you all talking about? But there is a reason why they're very stringent. There's a reason why they're implicated that way. There's a reason why they're written in that way or fashion. But to be able to make that awareness, like I'm saying, all the way from the top, introducing a lot of this, engineer Aboli talked about the 4 R's or the 5 R's, introducing that since school to let people know what those are, getting our kids' mind ready from the beginning on how to recycle, how to reuse, and how to do this, how to segregate waste, right? If we're able to segregate waste, if we're able to do the awareness to our population from the get-go, from the point of generation, we reduce, we reuse, we make it very less expensive than when we dump everything into a landfill. And a landfill, the way Ms. Rose talked about it, I haven't been to Sharikat, that is not what a landfill is designed to do. There's a lot of issue that comes with a landfill, which included leaches, which is very toxic solvent that actually leach into our water system. And I believe that landfill is not too far away from our water system, which is the Nile River, which a lot of our water comes back to our home. So there is a lot of things that happen to a landfill and how we do that. But it's back to awareness and education. If we implement that in primary school, we implement that in our city, we bring our stakeholders when we talk about waste management. And we talk about it, any rules, any regulation. Here, when we have any new rules, now that is from the national or from the federal rules. When EPA pulls, we're gonna pull this blah, blah, blah rules, you have to, it comes back to the people. Why does it come back to the people? In open forums and open communication, so people clearly articulated what those changes are gonna be. When as an industrial site, I ask for permit, which is something goes back to our regulation, right? That before this oil and gas company, before these hotels, before these buildings, before this hospital forms, they need to get a permit, and that's go back to our regulation. And in the permit, it clearly spells to this person how you're going to manage your waste, how you're going to manage environmental regulation, what are the checks and balance, and what will you be audited for. So once they get this piece of document, they get a permit to build, right? They get a permit from the Minister of Environmental that tells them how they're going to do that. Once you have that very clearly, before you issue a permit to any of these people, what do? You put it in a public notice. In Texas, we have English and Spanish. It has to be in both languages. In South Sudan, we're going to have to put it back to a lot of the common languages. So even the ordinary person gets a chance to read what's in it. Why is it so important to do that? It's back to the awareness and the communication to our stakeholders. So like everybody said, also a lot of challenges and a lot of issues just me listening to it. But I believe the biggest thing is getting our stakeholders together and making sure that we all understand what the rules are, what the regulations are, and maybe do things like, I don't know, areas where you have neighborhood challenges, awards, or whatever, the most cleanest neighborhood, the most cleanest city, or whatever you have to do. But bringing the awareness to the people and doing those campaigns, if it's being in the media, if it's being in print, if it's being here, they call it open town halls, uh, making sure we let people know. And when it comes to waste collection in household, like here, we have 3 different bins every week that you can put trash in. You have your solid waste, you have your recyclable, and you have your compost. So all that before you're able to get it, you get the 3 bins. And when it comes this document that comes with it that tells you what goes into what and why that is, and why we collect them on a different days and what way it goes. This goes to be recycled and create new resource. This goes to the landfill. This goes to incineration. This goes to the biofuel, like Engineer Bali talked to. So giving people those resources and making sure they understand it's really going to be a big impact for us with the environmental rules. So I'm going to look at my notes just a little bit. We talked about the lack of environmental rules and regulation in South Sudan, but I wanted to talk a little bit about what are the challenges too. Why is this an issue in South Sudan and a lot of the developing world? Because there's a lot of challenges that we face. And some of the challenges are limited financial resources and capacity, right? So a lot of the cities, we're talking about municipalities, like the Juba City Council, might not have the money or the infrastructure to do this, right? So a lot of that issue makes it a whole lot harder to do that. Limited access to technical knowledge, equipment, to handle solid waste. And I believe Ms. Rose talked a lot about this, about how a lot of these waste truck collectors don't have the right equipment, don't have the knowledge, don't have the right sanitation equipment. So those are some of the challenges that actually makes it harder to do the waste management program. Limited technical expertise and awareness of best practice. So you've sometimes found local government actually don't have the lack the expertise needed in order to identify some of their purpose solution, which is not the issue over here. We have a lot of knowledgeable women here which can give back to the city. So limited staff. I believe it was Ms. Rose that says that capacity. Sometimes you go to these offices and there is 1 or 2 people to address a whole city issue with waste management. Again, the resources are not available. Political turnover, biggest one, right? Changes in administration can actually let you shut down projects. So if we have turnover, we have administration that do not put environmental issue as the forefront. You can do all the work you have to do. As soon as you have a political over, that issue becomes where the back burner becomes a kind of an issue there. Lack of planning and evaluation in both the national and the municipality affecting the wastewater system. So like we talked about, the national framework or the regulation is so important in doing that. But once you have a lot of different bodies governing the issue and not very clearly understanding of what's going on and not being in one room and talking about it, that's very important. When you're able to talk about it, bring all the stakeholders together and discuss some of the issue, then that's become where you lack and things break in the middle. Things does not get to the people the right way. But once you have the stakeholders together, you're able to do that. And you're able to actually have the issue with the limit or the lack of the vertical government coordination with the city, with the government, with the Ministry of Health, here even with the Department of Transportation, because as you transport this waste across the city, there is so many rules and DOT regulation that you're supposed to have. But once you don't have that coordination and when you have that lack of information, then you have what chaos becomes in the middle and everybody start pointing fingers at each other because at the end of the day, the work is not getting done. And last point, Just one second. Cultural norm. We talked about that, right? So the issue of the cultural norms is that we have different cultures and tendency of why we do things the way we do. So in solid management, it's one of those. I think when I was in Juba last year, I was like, why is everybody so comfortable with littering? So I'm like here walking with my trash. I'm like, where do I put this? Right. And everyone's like, just jadini. I'm jadawin, jadini. So if those cultural norm and trying to make people understand and give them an education. I think I was in Munich and somebody's burning, open burn trash. And I'm like, and then the lady next to me is all coughing or like into asthma and stuff like that. I'm like, air pollution. And I'm wearing white dress and you can see the dust on my thing. But then she's like, wala yan. I'm like, how often do you do this? It's like, often. I was like, okay, now you wonder why you're coughing. And the issue with the air pollution, but the lack of education or the open storm. During the dry season, what happened? Everybody throws a big trash in there right in front of my dad's house in Wuniki. We have a big waterway that becomes, during the dry season, it becomes a dumping ground. That's where everything goes. Once it rains, where does that go? Straight down to the River Nile. And what happened? That water comes back to us. So just the lack of education and having people getting those awareness about the circle of how things goes, it goes. I think that would be one of our biggest public awareness. And the challenges, of course. The challenges is what? It costs money, it costs people, but more importantly, it costs the commitment from the ministry, it costs the commitment from the government to say that this is an issue, this is the forefront. We have a lot of regulation. We need an enforcement body, which is completely opposite, different from our regulatory compliance. And we're going to give them all the power. We're going to give them all the ability to do their job without being distracted, without having to walk into a facility and do your own inspection, and out of a sudden you're told you have to leave because so just having to have that understanding. But we're going to get there. I absolutely believe that South Sudan is a small country. And let's just remember, a lot of these environmental rules and regulation, how did they come about? They came about because of something going wrong and people deciding that we will never have this happen again. So once we get to the discussion, we at the national level say, hey, we're going to take care of our waste management system. We're going to take care of our water pollution. We don't want the next generation to experience this. This is when changes happen. RCRA and Clean Air Act in the US was not formed until the 1970s. So the US went through their own level in the 1950s and the 1960s, where they had the same issue. But now they are in a better place because guess what? The government and the ministry started that we are not doing this, and we recognize that we have a problem and we're going to do better. So just having that recognition and having them absolutely sure that we have a lot of resource, we have a lot of very smart people within our country, and we will get this thing tackled in no time. Thank you.
Thank you, Alice, for all those recommendations. Engineer Abalo Irene, we have just concluded that the country is still faced with a serious solid waste management problem. What are the barriers the engineers and policy experts are facing in tackling the issue of waste management? What are your recommendations moving forward?
All right, thank you. Thank you, ladies, for the brilliant discussions. So a lot of these barriers or challenges have already been mentioned, and affect only people, but also engineers. And what I can add on is, as engineers, there is lack of funding, lack of resources. You can come up with good designs for the waste management, you can come up with good ideas, but at the end of the day, they will be piled somewhere and dies there because there's no funding to implement all this. And also lack of policies to kind of allow for such things to be implemented. Now, another difficult part or challenge that we face, change of behavior. We are so rigid to change. People are just simply comfortable, as earlier mentioned. you come with suggestions and recommendations to do things certain way, and nothing happens, and people look at you like you're crazy or something. So those are some of the things that are so difficult, that makes it difficult for us as engineers, you know, to be innovative, because when you put out your ideas there and nobody does anything, so it demoralizes you, demotivates you, and you wouldn't want to do anything. I know a lot of brilliant engineers with brilliant ideas who would bring huge change, but they're just not bothered because you put a lot of effort and energy and nobody even wants to listen to you, first of all, unless you bring in money, you know, and then people want to listen to you. Now, my main issue is with the city council, because most of these waste-related problems is also part of the city council. In as much as we would like to, say this and that about the Ministry of Environment, the city council is to put answers, give us answers. I've seen city council being active, collecting, tax money from, put the same energy into waste management. And then when we engineers go to them, not only the city council, but people in charge, listen to us, support us, because we do need the support. Otherwise, we are born in a country where generational wealth is not really, with the war that has happened, there's no one that has accumulated generational wealth, where you can just come up with ideas and projects and you will be able to implement them without getting support from government or from people in charge. We do need that support. If we want to make change here, if you want engineers to make change, please support them, listen to them, because all we want is the best for our country. Now, as recommendation, Ms. Rose Tawil and Ms. Alice have already talked a lot that, if we listen carefully to them, there's a lot of knowledge they've poured out there. As Ms. Rose said, charity begins at home. Let's change our behaviors in the house. Starting today, if you go to the market with just your money purse and you come back with heaps of plastic bags, please carry something that you put your goodies in and come back with less plastic as you can. So let's start changing our behavior slowly, because if we wait that long for change to come from somewhere else, it won't come. It has to be from within, and it has to start from whoever is listening, starts now, and we move forward. I don't have much to say. A lot has been said. And when it comes to the technicalities and creation of awareness, I believe and I strongly agree that there's need for awareness creation and encouraging STEM into, like primary schools, so people are sensitized from such a young age. So when they grow up, you find in Europe, you find kids will never litter, so if that sort of behavior is installed into them from such a young age, they grow up, it continues on, and then it will be kept on passed and passed and passed to the next generation. So I believe let's all make that change, and let's support our engineers, and let's also trust our engineers, because you'll find we may be innovative, we create things, but nobody will trust or believe in our products. They would prefer to go and import, or they will prefer to hire a Kenyan, Ugandan, whoever, or buy products of those people done from their own engineers. So support your own, and let's all together make change and bring change. Thank you.
Thank you, Irene. Dr. Joy Luba, likewise, what are the challenges facing the healthcare sector in handling waste management, and what are your recommendations moving forward?
Thank you, Engineer Miriam, and thank you, the fellow speakers. I think the challenges that have been mentioned cut across all sectors, including the health sector. So the issue around, one, inadequate resources, I think that is generally across board. There is not sufficient resources to put the right waste management systems in place. For instance, we do not have sufficient incinerators in hospitals. We do not have sufficient waste disposal mechanisms like boxes for disposing sharps, and everything that's specified in the guidelines is not available and in those facilities. So I think one, and has already been discussed, is the issue of resources and capacity. Secondly, as noted throughout this discussion, is the issue of regulation. Because yes, we do have the guidelines in place, we do have a policy in place, but then there is no regulation. And I think the greater challenge here is with regard to the private sector. As mentioned, there's a lot of private facilities all over the place, even pharmacies as well. And, pharmacies also produce pharmaceutical waste when we have expired drugs. And so that kind of constrains the regulation even further, because it's such a challenge to really monitor. Even in terms of service delivery, it's already a challenge to monitor the quality of services that's being offered in the private sector. So then it becomes much more challenging when you want to monitor and regulate medical waste disposal. So that is a key challenge. How do we engage the private sector to actually address the issue of medical waste management and to ensure that it's being effectively handled? Thirdly is the multi-sectoral nature in terms of the impact on health from other sectors. So it's not just the waste produced within the health facility or in the health, through the health system, that impacts on health. I think through the discussion we've noted that there are other wastes that actually impact on health. We have the oil sector, we have the industries, and as the country continues to develop and there's much more investment in the country, then we are actually also just increasing the amount of waste that's being produced. And without regulation, that then leads to a greater impact on the health of the people. So then the nature of health, the fact that there's so many sectors that do impact on health, is a challenge, because there's only a limit to which you can control what is happening. And I think as one of the speakers noted, if you don't have the evidence, if we don't have evidence generated within the country to actually show that there is an impact from other sectors on health, then it becomes really difficult to advocate for additional resources, to advocate for change. So that is a key challenge. And lastly, one key challenge I'll mention is community compliance. Yes, the government has its responsibility, but I think community also has a big responsibility, as has been noted. And I think behavior change has been highlighted, and just taking measures to prevent. Yes, the environment may be polluted, but there are measures that individuals and communities can actually take to prevent themselves from getting infected. And a lot of most of the population do not follow the basic principles that would actually protect them from contracting diseases due to wastes in general. In terms of recommendations, I think just this would focus on those key challenges that I've noted. There's need for greater investment, but investment needs to come based on evidence. Without evidence, you cannot advocate for additional resources. So it's critical that you generate the evidence that you will use to advocate for additional resources to the sector. And then, of course, strengthening regulatory mechanisms. And I would want to mention harnessing expertise. I think there's a lot of expertise in South Sudan. It can be demonstrated by this discussion that we're having. There's a lot of expertise in South Sudan, even if it's in diaspora. How do we harness all that expertise to really use it to better our country? And so that's really critical. I think we need to take that step. The government has its role to play, but we as technocrats and experts, we do need to take initiative and take responsibility and actually do something to address the issue of waste management. And of course, lastly, is to advocate to the community and do a lot of promotion to really encourage the community to take up behaviors that would address waste management. We see in other countries like Rwanda, they have a day when everyone comes out and they clean their environment. And I think that we need to think of such things that gives the community responsibility over their own environment. So that is what I would briefly summarize as some of the key recommendations to address the issue of waste management in South Sudan. Thank you.
Thank you, Joy. Ms. Rose Michael, to sum it up, what are some of the challenges facing the implementing partners in supporting waste management initiatives and WASH in general in South Sudan? What are the recommendations you propose?
Thank you so much. I had mentioned so much of the challenges, I think, when I was discussing previous topics or previous issues. But just to mention a few, I think Dr. Joy has summarized very well some of the challenges and also some of the recommendations that we really need to take it forward as a country. But I really want to emphasize the issues of community awareness, because I said earlier that no one is coming from somewhere to come and clean for you. We have to start it ourselves. Littering, you will see somebody drinking water from this water bottle and just litter it. And I mean, it's not a big deal. It's not a big concern. So that by itself need to change. People need to change their behavior. If we want to see Juba clean, if we want to see other cities clean, if we want to see South Sudan being clean, we need to start changing our behavior. We need to start littering, and we need to start really, just carefree. Somebody's coming to do it. Somebody's coming to pick this garbage. I mean, it's our responsibility to start loving our country and making sure that it is ourselves to do it. The issue of resources is very crucial. I think even having these ministries without resources, there's very little that these ministries can deliver and implement. So resources is it's very important to be allocated, especially the social services need to have resources allocated to these ministries. The issues of the right skilled people within these structures. If we don't have right people, then it's just waste, because we need people to do the implementation, be it from outside or inside within South Sudan community. People need to have the right people doing the right job. Continuous advocacy on these kind of issues. I think it's one challenge also that I mean, people are not talking about it. People are not talking about it, but it's high time for people to start talking about it. And I also want to mention, like I said, some of the challenges we've already talked about it. I will not dwell so much on it, but I will come to recommendation, which I have already started, the issues of advocacy, the skills that are required to do the job. I want to take the example of Rwanda, as Joy said. They love their country. They're doing it every end of the year, even right from the president down, coming out of the street. Coming out of their comfort zone to come and clean Rwanda, to come and clean Kigali. We can do it in South Sudan. But our problem is we do it when we see the president of Egypt is coming to South Sudan. We start beginning to clean the cities. We clean the streets. We clean, painting all the roads. And we don't need it. We don't need to impress people that is coming from outside that we are cleaning our cities. We should impress ourselves as South Sudanese. We start, by cleaning our towns every end of the year or every end of the month or so forth. I think this cleaning campaigns needs to really come up. Juba City Council is collecting a lot of resources from shops. What are they doing with these resources? Let them organize this cleaning campaign. It should be something that is cascaded from down upward. It should be something that is, inbuilt within the system, that this is not something that we have to do it just because somebody is coming, or, you are taking resources from the business people. people need to see these services happening. So my recommendation would be really this cleaning habit should not be only when somebody's coming. It should be a habit that as a country, people should really take it, that we need to see every month or every end of the month, people coming out to really clean the city. And the other recommendation would be Juba City Council and the Ministry of Environment. I think they should really act as a catalyst to commence dialogue when it comes to advocacy. They need to start talking to each other. They need to come together every time and call the other stakeholders that, guys, let's do this. What are we supposed to do? There are brains out there. There are brilliant ideas out there, but people don't have that forum to come together and put them in the table. So I would really recommend that the Juba City Council and the Ministry of Environment should act as a catalyst really to commence the dialogue and call the stakeholders to come together, bring all the development partners to come together and start dialoguing, start talking to each other and have that resources that are hidden to come out. So I think most of the recommendations have already been said, but these are few that I can mention. And just last one, I had mentioned the issue of the waste pickers. These waste pickers really need to be protected. As they're doing their job, they need to be protected. They need to be really given the right equipment, the right gears to be able to pick this waste. So I think with this, I would say thank you to all of you. And thanks so much to Aisha and the team for giving me this opportunity. Thanks a lot.
Thank you, Rose. In conclusion, Ms. Nathan Hotmai, what are the main challenges facing South Sudan oil industry in handling its waste management policy and its implementations? What do you recommend?
Thank you. Due to time limit, I think we are way over our time. But I think the issue of waste management, regardless of what sector it comes from, is cross-cutting across. And I think it's probably one of the key concerns that we're all coming out here. I think for me, one of the primary challenge here is the incomplete laws and regulations that are actually needed to put the house in place, let's say the government, to be able to really exercise their role. What I mean here is that when we look at the Ministry of Environment, yes, it might not be implementing, but one of the reasons the Ministry of Environment might not be implementing its role or mandate, because it doesn't have the law or the act. The act is still a bill. You know, the South Sudan Environmental Act since 2010, if I'm right, but don't quote me on that, has been in a bill. It has not been passed. So basically, they don't have the mandate, or the mandate to be able to exercise their role. And probably one of these is probably one of the key costs, because if they don't have the mandate, they're not going to go out there and sort of implement that. As well, the regulations, the environmental regulation as well, does suggest the creation of the Environmental Management Authority, if I'm well correct. And the role of this authority, because the bill or the law has not been enacted, this institution cannot be formed. And some of these roles that need to happen is supposed to be actually exercised by this institution. They're supposed to make policies, guidelines, procedures that now are passed on to the Minister of Environment, so that the Minister of Environment now will implement its mandate. Out of this, without these ones, nothing can happen. Now, as a consequence, now we've seen now there's overlapping of role, and there's no separation of role in terms of who's making policy, who's enacting regulations, and who implementing them and who's monitoring them. I've seen now the Minister of Environment, Petroleum, who is actually who's supposed to be now who's supposed to be the implementer, is basically almost carrying all the roles of making policy, proposing regulations, implementing, monitoring. And the other institution, Minister of Environment, is not even put in place when it comes to even, especially on the oil sector. They are only consulted. But actually, in real sense, it's the role of the Minister of Environment to be able to carry out the protection of the environment. And this comes down to another challenge is lack of will from the political, from the government. If your house is not in order, there's definitely no way you're going to be able to put on rules and regulations and be able to hold other people accountable when you're not even holding yourself accountable. And that's come to my recommendations. It's very important. The bill, it's passed so that the Minister of Environment is given the mandate to be able to carry out its role mandate, so that the Environmental Management Authority is formed, and they need to go to work. They need to form the procedures, regulations, and now come together with the Minister of Petroleum. They need to renegotiate the roles, because some of the roles that the Minister of Petroleum is doing is not their roles. And somehow the Oil and Gas Commission as well need to be empowered to be able as well to put, when you look at the Minister of Petroleum as well, it doesn't even have policy. I think the policy is still as well in draft. So without all these policy and laws, these people will not be able to really hold the stakeholders accountable. The environment will not be protected, and the people will not be protected. And I think this brings the end to my conclusion. And thank you guys so much. This has been a wonderful discussion. It has been a lot of learning. Thank you. And for those who are listening.
Thank you, Nyathan. This brings us to the end of a very informative discussion. I would like to thank the panelists for taking their time to participate in this discussion today. I also want to thank the UN Women for their support for this forum, and the audience for taking the time to listen to this important discussion. My gratitude also goes to the technical people behind the scene from the South Sudanese Women Intellectuals Forum. Please tune in at the same time tomorrow for our special edition with the chairperson of the South Sudan Relief and Rehabilitation Commission, Honorable Dr. Manasseh Lomole Waya. Thank you and have a great morning, afternoon, and evening.
Thank you, guys. All right.
Thank you.
Thank you, everyone.
Thank you.
Thank you, ladies.